Well, thank you for having me here today. I heard Carl say that we're going to have some exciting presentations and we're going to hear from some experts. I've not been described as exciting, nor am I probably an expert, but you will hear from me today. And no, I did not stay at a Holiday Inn Express last night, or a Red Lion, or a Courtyard Marriott, or a Hilton Garden Inn, anyone else in here. I didn't stay at any of your places last night. So you're going to get what you get. But I do appreciate being here, and it's certainly a great pleasure for me to be able to give you this riveting talk on update on healthcare, on our economy in the Tri-Cities. And when I was asked recently to do this, I went back and looked at the last 3 years' worth of presentations to kind of see what had been discussed. And I have to tell you, I went through pages and pages of numbers and graphs and dire predictions, and I finally came to the conclusion that although 2012 was a different year, the story was more of the same. Healthcare insurance premiums are going up. Uninsured and underinsured population is increasing. Aging population is growing. We heard about that earlier, and I'm now one of those aging populations, and one of the products of my own predictions, I guess. Healthcare expenditures are rising, and healthcare reform continues. Now, I could really sit here and talk about any one of these subjects for a lot more than my allotted time, but I know that Chris Johnson says he has to have more than 3.5 minutes, so we have to get through this. Many of you, and probably even myself, by spending a lot of time on those items, may not really understand what we're talking about. So I want to take a little different approach today and try to show you, based on some of the available data, what the impact of our three hospitals, Lourdes and KGH and Catholic, have on the Tri-Cities economy. And I can tell you, and I think we saw it in one of the earlier presentations, healthcare is one of the fastest growing segments in the Tri-Cities and probably in our state, which means more jobs, which obviously is part of the economic growth. We are seeing all three of our local hospitals enhancing and expanding services, which allows us to keep more patients in the community, which again creates more growth. And as you heard from Susan Creed, more patients are coming to the Tri-Cities to seek health care, which means we bring more patients from outside the marketplace to the Tri-Cities to receive care. And we're also seeing an interesting physician dynamics. I know all of you have heard of all the predictions of shortages of physicians. That is real. It's going to be real. But we're also seeing another dynamic where physicians are looking to join a bigger organization rather than go be an independent practitioner. And that really does change the dynamics of healthcare in our community. I asked the Washington State Hospital Association if they had some data that could kind of give me some interesting numbers. And this is what they gave me, which shows the impact of healthcare in the state of Washington. This is the same numbers for the Tri-Cities, and these are for 2010. And you see job FTEs of about 2,900. Actually, I believe that number today is closer to 4,000. And so we're seeing tremendous growth. I then went and said, let me look at the Tri-Cities and try to pull from the Washington Department of Health some numbers. And so I went to 2003 and then 2011, and I looked at three numbers: our revenue growth, our labor growth, and the uncompensated care, which is bad debts and charity care. And as you can see, all of those have changed on an annual basis significantly. 21.7% revenue growth, 14.5% for labor costs, which means employees, and about 39.5% for uncompensated care. So the reality is we are facing some very significant challenges, but I have to tell you, each of the hospitals in the Tri-Cities have continued to focus on how do we improve our services, how do we provide better value to our community, and I know these efforts will continue in the future. All KGH, Catholic, and Lourdes has and will continue to work on keeping our healthcare industry healthy and growing. We are proud of our collaboration with both CBC and WSU in this community. We're obviously looking to help grow the nursing force and the other skilled labor force. It's been a great partnership. All three hospitals are involved in this. We're also proud of our partnership with Pacific Northwest University of Health Sciences, which is the new medical school in Yakima. We have been working with the three hospitals in this community, and over 80 preceptors. We've been having medical students rotate through here for the last 4 years, really giving them a foundation to become physicians. It's been a very exciting time. We have over 80 preceptors in the community that volunteer their time to help train and teach these young men and women and get them ready to become a doctor. This next year, this year, KGH is actually taking our next big step. We have developed a residency program. We'll be taking our first residents in family medicine and internal medicine in July. Very excited about that. We had over 60 applicants for our 4 slots, and we're in what's called the match now, so we're really excited about that. We really had a vision 5 years ago that we wanted to be a teaching hospital, and in 2013 that is coming to fruition. We also continue to collaborate with all the other 2 hospitals, KGH, Lourdes, and Catholic. Now, you know, obviously we do compete with each other in some things, but we have a very strong partnerships in the Tri-Cities Cancer Center, Tri-City Laboratory, and we also work together in support of several other nonprofit organizations in this community to create better health for our community, and we've done a lot of work in that. So, whoops, did I do that? Thank you. Let me get back on speed. While the future has some challenges in front of it, and we will be facing some unknown things out there, we know that KGH and the other 2 hospitals in the Tri-Cities will continue to expand access and reduce costs. You know, we heard about health and wellness. It's time that we really start focusing on how do we keep people well? How do we fix them and do preventive maintenance rather than waiting until they get sick and then have to fix them? It's like changing the oil in your car. We have to do more of that. KGH is very excited about our new Southridge project, and I have to talk a little bit about this. You know, we have lots of people who have worked long and hard to bring this project to fruition. We face many obstacles and challenges, but you know, we're right now building the state-of-the-art hospital at Southridge, and we're also very, very excited about our plans at the Auburn campus to develop a first-class women's and children's facility. And of course, our Vista Field campus, which is an ambulatory campus, will continue to be a great ambulatory campus, and we're excited about our future. Undoubtedly, changes will continue to happen in healthcare, but I am pleased to announce, from my perspective, that the Tri-Cities healthcare is healthy. Thanks so much for allowing me to participate today, and good news is that you won't have to hear from me for at least a couple more years, so thank you.